Hello, my name is Venet. I am a senior researcher at Fondazione Bruno Kessler Research Institute in Trento, northern Italy. So I would like to thank the organizers for this kind invitation. And today I will be talking about mobile technologies and how they can impact healthy aging. So just to start off, we all know the aging trends. I don't think I need to explain this. We know that all of us are getting grayer and grayer. But instead of talking about statistics, what I would like to do is just talk a bit about this concept of the population pyramid. Because this will then set the scene of the work that myself and my group are doing here. So when we look at the population trends, we see here on the left that there is overall there are 4 stages. The first stage is the expanding, where we have an expansion of the population. We see that, for example, at the bottom of the pyramid is quite wide, so we have a lot of young people due to high birth rate, but then at the top we have very few also people over 65, and this is because there is a high death rate. And this kind of trend continues over these 4 stages, whereby at the stage 4 we actually have a contracting population, meaning that we have low birth rate. We can see at the bottom that the base of the it's not a pyramid anymore, but of this shape is not as high. And then we see also at the top that it has expanded with respect to stage 1, so meaning that we have also low death rates. And actually, when we look at the actual statistics, we see that now in Europe we are at stage 4. So we have both low birth rate, low death rate, and the overall population is contracting. Now, so as a result, we see more and more age-related issues. So some of these common issues relate to well-being, to chronic diseases, and to mental health. So today I will mostly be focusing on well-being and chronic diseases because I only have limited time. So we have also done work on mental health, especially in detecting and predicting depression, but perhaps this will be an opportunity for another time. So the question is, given that we are aging, given that we are seeing more and more health and well-being issues, how can we use technologies in general and mobile technologies in particular in order to help with this huge challenge that not only Europe but the whole world is facing? So one of the things that mobile technologies can do quite well is support well-being and longevity. So I am part of a European project called WellCo. And in WellCo, what we are doing is we are creating this personalized coaching that lives on a phone and then provides useful advice to elderly. So WellCo is a project that has started in 2018 and will finish in 2021 next year. And in there, what we have is, what's interesting I think about this project is that the coach itself not only gives advice, but gives personalized advice. And what I mean by this is that we have also an app on the phone, and we have also set of wearables that are constantly monitoring behavior and various aspects of everyday life of the elderly. And then we are using the collected data from both smartphones. So this is the kind of data that could be, for example, data on mobility patterns, how much they are staying inside their home, how much they're going out, data on social activity, for example, if they are, socially active with other people or less, data, of course, obviously on their physical activity. And then we are taking all this data and creating machine learning models that can predict a risk of a person having a specific chronic disease or a risk on their well-being. So the coach then is using this information. So depending on specific risks that have been identified, the coach is using this information to target that specific behavior that will, in the long term, decrease the risk, hopefully, and thus improve or preserve their well-being. As I said, we are targeting various aspects in Wellco. For example, you can see here on the left where we have the phone, and the phone is collecting all this information. In addition, what I haven't shown here is we also have a kind of wearable that, in addition to the physical activity, also collect things like heart rate and temperature and things like that. And then the Wellco coach decides, for example, which of these aspects to target. One could be physical activity, one could be cognitive exercises, one could be nutrition. In terms of social activity, perhaps it can advise in supporting groups and so on. So what we are currently doing in Wellco is that we are recruiting about 150 people, and we're going to do a trial with these people for 6 months. So each of these 150 people will have their own phone with the Wellco app and the wearable device, and then we'll have monitoring data with them for around 6 months, and at which time they will also receive personalized advice. So these people, the elderly people that we have are across 3 pilot sites, one here in Italy, one will be in Spain, and one in Denmark. And then the trials we are currently at the recruitment stage, and we expect to have the first results at the beginning of 2021. And then hopefully there will be another opportunity to actually present these results and what we found and the lessons that we actually learned. Second aspect that I want to talk a bit about is chronic diseases. So I want to simply show an example that what we are doing here in Trentino. So we have a platform called Track that you can see here in the middle. That is a personal health record platform that supports each citizen. So meaning that what we have in here is an app on the phone that can access both electronic health records for each citizen as well as user-generated data. So we have things, like physical activity, perhaps a diary, answers to specific questions or validated questionnaires and things like that. So in here, in one study, what we wanted to see is that given all this wealth of information, is it possible to predict whether a person has a risk of developing diabetes or diabetes-related complications? So in one study, what we've done is we took the clinical data, so electronic health records, and you can see here on the right some of the data that we collected. For example, we collected things like glucose levels, HbA1c tests, cholesterol, triglycerides, and so on. So we put all this data into a machine learning model, which was based on recurrent neural networks, so deep learning approach. And then we looked at whether we can predict one of the complications that this person has had the risk of experiencing. And an initial set of results can be seen here. So given the patient's clinical history, we were able to predict, for example, diabetic retinopathy with a quite high level of area under the curve. So it was close to 95%. And also lipoid metabolism, which was slightly lower, but still relatively high at 92. These two complications are only two examples, and I didn't present all of them because in total we were able to predict around 7-8 complications related to type 2 diabetes. So what these results show, they of course are simply an indicator, but what they show is that there is a very big potential in using both mobile technologies and clinical data in order to predict the risk of a person developing a specific disease or disease-related complications. So what this means is that, if we are able to actually predict the risk of a person developing a specific condition, then this will have a major impact on how we organize care. Since right now we have the way that care is delivered is that more or less one size fits all approach. However, with specific risk prediction, it is possible to actually target high-risk individuals, which of course has the potential to improve outcomes. So given this information, how do we see that this transformation of healthcare from one size fits all to personalized healthcare based on prediction models? So what I want to do is just show here what we are doing here in Trentino. So as I said, on the left we have the traditional healthcare, so one size fits all medicine. On the right, what we have is the approach that we are adopting with our local healthcare authority. So at the top, you can see that we are using various deep learning methods and machine learning methods in order to analyze all the available data that we have for the patient population, and then create models that are able to predict the risk, various risks for each of these patients. So we do that by actually modeling the patient trajectories and then provide personalized treatment. On the second step, what we have is a platform, virtual coaching, similar to the one that I described previously on as part of Wellco project. So this platform is able to interact with personal health records, also with a track platform that I showed before, and then for each patient, it's able to provide personalized advice so that specific lifestyle behavior can be targeted for a specific patient. And then, of course, this has the potential to for these advices to be much more effective and hopefully in the future provide better outcomes in terms of increasing the number of years that people spend in good health. So, in conclusion, on this short presentation, I wanted to emphasize that there is a very exciting future for mobile technologies. They have a huge role to play in health and well-being, not only on patients, but in population in general. So one of the aspects that I show here is that health technologies can actually help older people maintain their health and well-being. Prediction is definitely an important aspect of this, because prediction allows us to target high-risk individuals. And then giving all this information as kind of a final objective would be to provide timely intervention for the identified patients at risk, which hopefully will then result in extended health span. And health span is the part that I mentioned, where is the number of years that a person spends in good health. So thank you for your attention, and here are my contact details.